interested to talk today about hypertensive disorders in pregnancy. It's quite a broad spectrum of disease. We will try to narrow it so that we get through for a better understanding. Okay, what is hypertension? Hypertension, according to the World Health Organization, it's blood pressure, whereby the systolic blood pressure is of at least 140 or more, and the diastolic of 90 or more. Now, the spectrum of hypertensive disorder in pregnancy is quite huge. There are patients who conceive being hypertensive. Those ones, we know them as chronic hypertensive patients. And chronic hypertensive patients, then eventually they will sometimes develop what we call superimposed preeclampsia. I'll get to that. But a entity known as pregnancy-induced hypertension is hypertension which occurs for the first time during the second half of pregnancy, and that is after 20 weeks of gestation. If a person outside pregnancy does not have hypertension, and then eventually when they reach 20 weeks, they develop high blood pressure, that is known as gestational hypertension. And such patients, sometimes they go on to develop protein in the urine or target organ affectation. And if such happen, that will be known as preeclampsia. Basically, preeclampsia is hypertension in pregnancy with one or more target organ affectation. Target, I will go through later on. We will get to understand what is that. And then the patient with chronic hypertension. Chronic hypertension, usually we find it in patients above 30 years of age. They tend to have what we call essential hypertension. Essentially, it's basically hypertension where we don't know the cause of the high blood pressure. And we have those ones who are having a secondary hypertension. Those ones, one should look for the cause why they are having hypertension and address that cause. Sometimes it may be renal artery stenosis leading to hypertension. In secondary causes of hypertension, we have chromophilocytoma. We have diseases like Takayasu. In such patients, then it's important for one to check and find the cause, address the cause, and then the patient will be fine. Now, high blood pressure. The classification of the high blood pressure, we have gone through the different categories, and then we have to talk about the severity of the high blood pressure. When do we say that high blood pressure is severe? Or before we get there, we can talk about the pathophysiology of the preeclampsia. The cause of preeclampsia is basically unknown, but there are different theories trying to explain why patients develop preeclampsia. And the most accepted is what is known as the failure of the second wave of trophoblast to invade the myometrium. That is the most accepted theory. And with that theory, it also postulated that preeclampsia is a two-stage disease. In a sense that the first stage, the disease starts as the trophoblast invades the myometrium. That second wave fails, and then it's a placental disease. Once that happens, then the uteroplacental unit will secrete some chemicals, which then will affect the endothelial system in the whole body. It's a multisystemic disease affecting the endothelial system, and then lead to vasoconstriction and then hypertension. And with that, we will see the complication both in the fetus and in the mother. Those are the two different stages. Now, the severity, when do we say that the disease is severe? In the past, we used to say, classify the hypertension into mild, moderate, and severe, but now it's just divided into two. We have the mild and the severe disease. A mild hypertension would be high blood pressure, which is having a systolic of less than 160 and a diastolic of less than 110. Once you reach to a systolic of 160 or more, that will become severe hypertension, and a diastolic of 120 and more, or that will 110 and more, that will lead to what we call severe hypertension. Now, we talked about target organ affectations. Target organ affectation, we will look at different organs in the mother and also at the fetus. In the mother, we have the hematological system. In the hematological system, we pay attention on the hemoglobin. When there is hemoglobin, the hemoglobin is decreasing, and evidence of hemolysis, which can be evidenced by elevated LDH, which should be around the range of 600, that will be indicative of severe disease, and also evidence or suggestive of hemolysis. There are other tests which can be more specific to prove that there is hemolysis, such as the spherocytosis, reticulocytosis, and that is on peripheral smear. Once you do and you find that, then that will be evidence that there is a hemolysis. We look at the platelet also. A platelet, when they decrease, that also will be indicative of severe disease. Thrombocytopenia. Thrombocytopenia is classified into three groups. We have the mild, moderate, and severe according to the Mississippi classification. Mild thrombocytopenia would be anything between 100 and 150. That will be mild thrombocytopenia. Moderate thrombocytopenia would be between 50 and 100. And anything below 50 would be severe thrombocytopenia. And we look at the kidney. Once we have kidney affectation, the kidney function is affected, either being it urea rising, creatinine rising. Those also will be indicative of severe disease. We look at the liver. We look at the liver function test, where we check the transaminase, which should be less than 40. Once they go to more than 40, that will be indicative of severe disease. We thank you very much for taking your time to watch the video. I hope you have been enlightened, and it will assist you in terms of, for those who are in the medical field, in terms of handling such patients and referring them to appropriate centers. And for the ordinary people to know that high blood pressure is a serious condition and severe, which should not be taken lightly as people lose their lives. Thank you.